So if you've got, when you do the assessment and you've got really limited internal rotation, like none or about that much on one or both sides, this exercise is very useful for you to do. It takes about a minute to do each side. That's all you need to do. And then after that, we integrate that new movement with the exercises of the Warrior Legs course, especially the squatting based ones. So this next exercise is to use a foam roller to not just foam roll and release tension out of the TFL muscles here on the sides of your hip. They're usually very dominating in their influence, and they're being used too much by the body. If they're being used too much, often the glutes can be, especially the glute medius muscle on top of the glute here, it can be difficult to do its input. So when we knock out some tension through here, it does a few things. It allows that glute med to better fire up naturally. As this drops out, the glute med fires up. What it also does, and a big reason why we're doing this in this way, is to create more internal rotation in the hip. So the side that you're laying on, the hip will move over the leg, so it creates more space inside the joint here for an internal rotation or roll and glide of the hip joint, the femoral head inside the hip joint. There's a big reason why we're doing this. It also allows, most people's pelvis is open this way. So it allows the pelvis to come in this way, which more promotes internal rotation of the femur. The tibia can rotate better and the feet can pronate better, so there's a link there. So how you find where to put the roller, so if you feel into the soft part, so your obliques, your waist, you feel into the soft part. So that's here for me. So the top of my hips are here. And if I then feel down further, and I just make my hips go side to side, I'll feel like a hard bony part come out as I'm pushing over here. And that's the femoral head. So we're essentially between my hands here. So my thumb is on top of my hip, my fingers here on the top of the femur. So in this area here is where the roller goes. And it's a muscular area, but it's influencing the bones. So I've got the foam roller in the right spot here. My foot stays flat like this. So it allows the leg to stay relatively still on this side. I bring the foot over the other side, and then I'm just rolling forward. I'm aiming to relax here, putting pressure through my arm so I can relax my bottom leg here. And I'm aiming to get my knee towards the ground. And you'll feel it massaging the TFL muscle. But what's happening is that my bottom leg here is staying relatively still, but my pelvis is moving over the joint each time. So it's creating a relative internal rotation force in the bottom leg. And the main thing is you just relax the muscles of the bottom leg so that TFL is not active as you do this. So I've got a lot of pressure going through my arms. And when you first start, it might be really tricky. You might be able to get your knee to the ground. That's totally fine. Over weeks, months, you will be able to. And often it's in days that you can do it. So we do 1 minute, then of course we change sides. My bottom foot is straight like this. Other foot comes over, resting through the arm. Aiming to get that knee to touch the ground.